Welcome, future CNA and healthcare champions. Whether you're preparing for your state exam or brushing up on the latest 2025 protocols, this 50-question practice test is your ultimate study tool. I've carefully crafted these questions to match the real NNAAP exam format, with detailed explanations for every answer. How to use this video. Pause after each question. Test yourself before seeing the answer. Take notes. Key 2025 updates are highlighted throughout. Let's build your confidence together. Ready? Let's dive in. Question 1. What is the first step before touching a patient? A. Put on gloves. B. Wash hands. C. Sanitize surfaces. D. Wear a gown. Correct. Answer. B. Explanation. The CDC's 2025 guidelines require hand hygiene before any patient contact. Gloves are only effective when applied to clean hands. Question 2. When should an N95 respirator be worn? A. When serving meals. B. During routine vital checks. C. During aerosol generating procedures. D. When making beds. Correct answer is C. Explanation. 2025 OSHA Standards Mandate. N95 used for procedures creating airborne particles, e.g. suctioning nebulizer treatments. Question 3. A resident suddenly collapses. Your first action should be A. Perform CPR immediately. B. Check for responsiveness. C. Document the incident. D. Call the family. Correct answer is B. Explanation. Always assess consciousness before intervention per 2025 BLS protocols. CPR is only for unresponsive patients without pulses. Question 4. The S in PASS, fire safety, stands for A. Sound the alarm. B. Spray the area. C. Squeeze the handle. D. Secure the exits. Seman's correct answer is C. Explanation. Pass. Wear pull pin. Aim low. Squeeze handle. Sweep side to side. 2025 NFPA update. Question 5. How should you assist a resident with dysphagia during meals? A. Encourage talking while eating. B. Offer thin liquids freely. C. Provide small moist bites. D. Serve all foods piping hot. Sean, correct answer is C. Explanation. 2025 Aide guidelines recommend moist, bite-sized foods to reduce aspiration risk. Thin liquids require thickening. Question 6. Proper denture care requires A. Using hot water. B. Scrubbing with regular toothpaste. C. Storing in a dry tissue. D. Placing in a labeled cup with water. Correct answer is D. Explanation. Dentures must be stored in water to prevent warping. Hot water damages them, and toothpaste is too abrasive. Question 7. Where should you place the stethoscope for blood pressure measurement? A. Over the radial artery. B. On the brachial artery. C. Below the elbow crease. D. On the carotid artery. Boy's correct answer is B. Explanation. The brachial artery, inner elbow, aligns with the heart for accurate readings. Question 8. A blood pressure reading of 150 over 90 millimeters of mercury indicates A. Normal range. B. Stage 1 hypertension. C. Hypotension. D. Hypertensive crisis. The correct answer is B. Explanation. 2025 AHA guidelines classify 130 to 139/80 to 89 as stage 1 hypertension. This requires monitoring. Question 9. A resident refuses medication. You should. A. Hide it in their food. B. Force them to take it. C. Document and report the refusal. D. Withhold all future doses. The correct answer is C. Explanation. Residents have the right to refuse treatment, document, and notify the nurse immediately. Question 10. First aid for a bleeding wound involves A. Applying direct pressure. B. Pouring hydrogen peroxide. C. Removing embedded objects. D. Tightening a tourniquet immediately. The correct answer is A. Explanation. Direct pressure controls most bleeding. Tourniquets are last resort for life-threatening hemorrhage. 2025 first aid protocols. Question 11. Which PPE should be worn when emptying a catheter bag? A. Gloves only. B. Gloves plus gown. C. Face shield only. D. No PPE required. Correct answer is B. Explanation. 2025 OSHA standards require gloves and gown for potential splash exposure to bodily fluids. Question 12. A resident's oxygen tank is leaking. Your first action is to A. Turn off electronics. B. Evacuate the area. C. Try to fix the leak. D. Open windows. Correct answer is B. Explanation. Oxygen supports combustion. Immediate evacuation prevents fire risk. 2025 NFPA emergency protocols. Question 13. How often should oral care be provided for unconscious residents? A. Once daily. B. Every 2 to 4 hours. C. Only when family visits. D. Never needed. Correct answer is B. Explanation. Unconscious residents cannot clear oral secretions, requiring frequent care to prevent aspiration pneumonia. Question 14. A pulse oximeter reading of 89% indicates A. Normal oxygenation. B. Mild hypoxia. C. Severe hypoxia. D. Equipment error. Correct answer is B. Explanation. Normal SpO2 is 95 to 100%. Below 90% requires intervention per 2025 clinical guidelines. Question 15. A resident with Alzheimer's asks for their deceased spouse. Best response? A. They died years ago. B. Redirect to a favorite activity. C. Pretend to call the spouse. D. Ignore the question. Correct answer is B. Explanation. Redirection avoids distress while validating emotions. 2025 Dementia Care Standards. Question 16. You find a coworker sleeping on duty. You must A. Take a photo as proof. B. Report to the nurse supervisor. C. Wake them quietly. D. Ignore it. Correct answer is B. Explanation. Patient safety requires reporting neglectful behaviors through proper channels. Question 17. When shaving a resident, you should A. Use a straight razor. B. Apply shaving cream downward strokes. C. Share razors between residents. D. Shave against hair growth. Correct answer is B. Explanation. Downward strokes prevent nicks and irritation. Never share razors. Infection risk. Question 18. Normal adult respiratory rate is A. 5 to 10 breaths per minute. B. 12 to 20 breaths per minute. C. 25 to 30 breaths per minute. D. 40 plus breaths per minute. Correct answer is B. Explanation. Normal range is 12 to 20. Rates outside this indicate potential respiratory distress. Question 19. A resident with diabetes complains of dizziness. Your first action: A. Give orange juice. B. Check blood glucose. C. Have them walk it off. D. Document later. Correct answer is B. Explanation. Always verify blood sugar before treating suspected hypoglycemia. 2025 ADA Guidelines. Question 20. The minimum time for proper hand washing is A. 5 seconds. B. 20 seconds. C. 1 minute. D. Only if hands look dirty. Correct answer is B. Explanation. CDC recommends 20 seconds with soap for effective pathogen removal. Question 21. When assisting with ambulation, always A. Let them walk alone. B. Use a gait belt. C. Hold their arms tightly. D. Rush the process. The correct answer is B. Explanation. Gait belts provide safe support without restricting movement. 2025 Safe Patient Handling Standards. Question 22. A resident's urine is cloudy and foul-smelling. This may indicate A. Dehydration. B. Urinary tract infection. C. Healthy kidneys. D. Overhydration. Correct answer is B. Explanation. Cloudy, foul urine is a classic UTI symptom requiring prompt reporting. Question 23. How should you position a resident for a bed bath? A. Flat on back. B. Semi-Fowler's position. C. Prone position. D. Standing. Correct answer is B. Explanation. Semi-Fowler's 30 to 45 degree elevation ensures comfort and prevents aspiration. Blunt question 24. When making an occupied bed, you should A. Roll residents side to side. B. Have them stand up. C. Change linens weekly. D. Skip the bottom sheet. Correct answer is A. Explanation. Rolling protects resident safety and maintains dignity during linen changes. Question 25. A resident is on fall precautions. You should A. Use bed rails at all times. B. Keep the bed in lowest position. C. Restrain them frequently. D. Limit all movement. D. Correct answer is B. Explanation. Low bed position reduces fall impact. Restraints are last resort only. Mama question 26. Normal oral temperature range is A. 95.0 to 96.8 degrees Fahrenheit. B. 97.6 to 99.6 degrees Fahrenheit. C. 100.0 to 101.5 degrees Fahrenheit. D. 102 degrees Fahrenheit plus. Correct answer is B. Explanation. Normal adult oral temp is 97.6 to 99.6 degrees Fahrenheit, 2025 clinical standards. Then with question 27. To prevent pressure ulcers, reposition bedbound residents at least. A. Every 4 hours. B. Every 2 hours. C. Once per shift. D. When they complain. But correct answer is B. Explanation. Q2H turning is minimum standard to relieve pressure points. Next question 28. A resident is crying after family left. You should A. Tell them to stop crying. B. Offer privacy and tissues. C. Ignore the behavior. D. Report it as depression. Correct answer is B. Explanation. Acknowledge emotions while respecting dignity. Report only if persistent. Question 29. When measuring radial pulse, count for A. 15 seconds times 4, B. 30 seconds times 2, C. 5 seconds times 12, D. 1 full minute. Correct answer is B. Explanation. 30-second count doubled provides accurate rate while saving time. Question 30. A resident says, "I'm in pain." Your first response should be A. It's not that bad. B. Where does it hurt? C. Wait for the nurse. D. Take deep breaths. Correct answer is B. Explanation. Always assess pain location intensity before intervening. Question 31. Which food choice is safest for a resident with swallowing difficulties? A. Dry toast. B. Mashed potatoes. C. Popcorn. D. Whole grapes. Correct answer is B. Explanation. Moist, soft foods like mashed potatoes reduce aspiration risk. IDDSI Level 4. Question 32. A resident's dentures are missing. You should first A. Check the meal tray. B. Accuse the roommate. C. Wait for them to appear. D. Document as lost. Correct answer is A. Explanation. Dentures are often misplaced during meals. Check food trays and rinse cups first. Question 33. When assisting with a bedpan, you should A. Leave the resident alone. B. Provide privacy and check frequently. C. Use the same pan for all residents. D. Skip hand hygiene afterward. Correct answer is B. Explanation. Maintain privacy while ensuring safety. Always perform hand hygiene. Question 34. A resident has reddened skin on their sacrum. This indicates A. Healthy circulation. B. Early pressure injury. C. Allergic reaction. D. Normal aging. Correct answer is B. Explanation. Non-blanchable redness is stage 1 pressure injury requiring immediate intervention. Miamod question 35. The best way to communicate with a hearing-impaired resident is to A. Shout loudly. B. Speak clearly facing them. C. Use baby talk. D. Only write notes. Correct. Answer is B. Explanation. Face the resident and speak clearly at normal volume for best comprehension. Question 36. A resident's restraint order has expired. You must A. Continue using it. B. Obtain new order or remove it. C. Ask family permission. D. Hide the restraint. Correct answer is B. Explanation. Restraints require current physician orders per 2025 regulations. Question 37. When a resident dies, your first action is to A. Call the funeral home. B. Notify the nurse. C. Remove all tubes. D. Clean the room immediately. Correct answer is B. Explanation. Only the nurse or physician can pronounce death. Maintain dignity until then. Question 38. A resident has a new wristband. You must A. Ignore it if name looks familiar. B. Verify against MAR before care. C. Ask the roommate to confirm. D. remove old band yourself. Correct answer is B. Explanation: always double-check wristband against medication administration record to prevent errors. Question 39. Before transferring a resident, you should A. Lock wheelchair brakes. B. Rush the process. C. Skip safety checks. D. Let them stand unsupported. Correct answer is A. Explanation: wheelchair brakes must be locked before any transfer to prevent falls. Question 40. A resident is confused about time. You should A. Argue about the date. B. Reorient gently. C. Play along with confusion. D. Ignore the behavior. Correct answer is B. Explanation. Calm reorientation. Today is Tuesday, June 10th. Reduces anxiety without confrontation. Question 41. When recording intake-output, you should include A. Only water consumption. B. All liquids and urine output. C. Just meal portions. D. Estimated amounts. Correct answer is B. Explanation. Accurate I&O requires measuring all fluids consumed and voided. 2025 documentation standards. Question 42. A resident is tearful about medical test results. You should A. Change the subject. B. Listen empathetically. C. Make false promises. D. Tell them to be strong. Tonight's correct answer is B. Explanation. Therapeutic communication involves active listening without judgment. 43. Which action violates resident rights? A. Allowing food choices. B. Sharing medical info with unauthorized people. C. Providing privacy. D. Explaining procedures. Correct answer is B. Explanation. HIPAA prohibits sharing protected health information without consent. Question 44. Before serving a meal tray, you must first A. Check the diet order. B. Add salt for flavor. C. Let it cool completely. D. Ask family permission. The correct answer is A. Explanation. Always verify the tray matches the prescribed diet, e.g. diabetic, pureed. Question 45. A resident's family brings homemade food. You should A. Discard it immediately. B. Check with the nurse. C. Serve it without checking. D. Taste test it first. Correct answer is B. Explanation. Some diets restrict outside food. Always consult the nurse first. Question 46. When a resident falls, you must complete A. An incident report. B. A dietary request. C. A shower schedule. D. A laundry list. Correct answer is A. Explanation. All falls require immediate documentation via incident reporting protocols. Question 47. To prevent nighttime falls, you should A. Use full bed rails. B. Provide adequate lighting. C. Restrict all fluids. D. Keep floors wet mopped. Correct answer is B. Explanation. Proper lighting helps residents navigate safely. Bed rails can increase injury risk. Meet the question 48. A resident is combative during care. You should A. Restrain them immediately. B. Stop and try later. C. Force the procedure. D. Scold them loudly. Correct answer is B. Explanation. Stop care and notify the nurse if a resident becomes combative to prevent harm. Question 49. When measuring height of a non-ambulatory resident, use A. A tape measure, B. An estimate, C. Last recorded height, D. The bed length. As correct answer is A. Explanation. Use a tape measure for accurate height while resident is supine, 2025 clinical standards. Question 50. Your role when a resident is dying includes A. Hastening death, B. Providing comfort care, C. Offering last rites, D. Calling the funeral home. Correct answer is B. Explanation. CNA provide compassionate comfort measures, positioning, oral care, while the nurse manages medical needs. Congratulations on completing this CNA crash course. If you ace these questions, you're well on your way to certification. If not, don't worry, review the explanations and focus on tricky areas. Next steps, watch the exam below, link in description. Comment below with your score or questions. Subscribe for more CNA tips and clinical skill breakdowns. Remember, every great CNA started exactly where you are now. Keep pushing forward. Your patients will thank you. Until next time, stay study strong.